Thank you. Good afternoon. My name is Alicia Staley, and I'm going to kick off the Health and Community panel for this afternoon here at MedX. I'm honored to be here, so I just want to say thank you before I even get started to Dr. Chu and the MedX community for inviting me to come back and continue to talk about the work that I'm doing. So let's get started. How do you define community? Very important question, because if you go to Google and you type in that exact phrase, you're going to get about 33 million hits back from Google telling you how to define community. Obviously, it was such an important term that they actually did some expensive research on how to define community in 2001. And I will spare you the reading of the details by jumping right to the conclusion that shows a very similar definition as to what you'd see in the dictionary. A group of people with diverse characteristics who are linked by social ties, share common perspectives, and engage in joint activities. So I think they proved the positive, or they proved what we already knew with that study. My journey to community started about 25 years ago, and it can only be described as something of a long and winding road. I was diagnosed with cancer for the first time when I was a sophomore at Syracuse University studying aerospace engineering. There was no one like me at Syracuse University that was dealing with lymphoma as a college student. I was very alone, very isolated, and really had nowhere to turn to at that time in my life. Because I'm a perfectionist, I decided to try to improve my experience by having a second bout of cancer with breast cancer in 2004. Like every good ePatient, I bring my scans and films with me to show with you. But unfortunately for me, I actually dealt with cancer for a third time in 2007. And I brought more scans, as you can see. These are what I like to call the before pictures. This is the after picture, because I had bilateral mastectomy in January of 2008. One common theme that I found throughout my entire experience as a cancer survivor in the 90s and early 2000 was Cancerland support was a very negative proposition for me. Every cancer support group that I went to, there was no hope for me. I was always the youngest person in the room with a disease that was highly treatable. And I was thrown into a room with a mix of different kinds of cancer patients, all at various stages of their disease, and I just never felt like I fit in. But for me, the third time was the charm, because after my third diagnosis in 2007 and after my surgery in 2008, I stumbled across a little thing called Twitter. Might have heard of it. And joined Twitter and was shocked to see in my Twitterverse, if you will, the people that I followed. This is actually a word snap of the conversations that were taking place on my Twitter stream. Cancer, chemo, life. And I realized that I had an opportunity to interact with people on a level that I've never had before. In 2011, working with Jody Schauger and Dr. Deanna Tai, we started with a what-if question, which is a very familiar theme here at MedX. What if we took the negativity of cancer support groups and actually turned it into something positive? And from that idea, we launched BCSM, a hashtag for breast cancer in social media. Here's a snapshot of our homepage that you can see now. BCSM, quickly by the numbers, this is only a 2-year snapshot, because if you try to pull more data from the simpler server, it just sort of conks out. So you're seeing only a small snapshot of what we've done, but we've actually generated over 500,000 tweets generated using the BCSM hashtag. BCSM is great, but does it make a difference? That was the next question that we struggled with over the last year or so. So much so that we worked on our own research study, asking could Twitter and social media be an effective tool for breast cancer patients for education and support. We presented a poster on this at the American Society for Breast Surgeons last fall, and I'm happy to say that we actually had our first paper published in the Journal for Medicine Internet Research back in July that basically says, yes, Twitter can be an effective tool for educating patients and providing a support network. What's next for community? My challenge today as somebody that's been on Twitter and involved in a lot of online communities is what do we do to make sure that community A gets to talk with community B? What if community A has the answer to what's in community B? We need to become a community of communities. The idea of meta communities is here. We need to begin to cross-pollinate and work together to further our individual missions and stop reinventing the wheel. So as a community of communities, we can come together and make a difference in the world today. Thank you very much.